I want to focus on a story that came in yesterday, striking nurses defy Uhuru's return to work order. You recall that press conference by the president alongside the Council of Governors chairperson Wycliffe Oparanya and the deputy Governor Mwangi wa Iria. And the president directing them that they have to return to work by Friday or else they will face the sack. But now the nurses are saying, our employer is not the national government, our employer is not the Council of Governors, our employer is the counties.
Yeah, I'll be saying that, you know, I think in my view it is sad, it's pathetic that we are back to the same discussion at the expense of the welfare, the livelihoods of our people, children in nursing homes, in clinics, in dispensaries. The discussion is back to how much do we earn or do we pay? Right. You know, it's about shillings and cents, not about people and lives in a better country. And I'm saying expanding that debate to this extent, not trivializing that nurses have got to be paid what is due to them and given you know, a welfare status that befits them and that's good for them. That's not what I'm saying. What I'm saying is that at both levels, the government and county governments themselves should be able, after all the haranguing, after all the discussions and negotiations and memorandums signed, that we should now have put this behind us, and we'll be asking ourselves, with all these issues about equipment that we have new in our hospitals, about issues about restructuring of KEMSA, you know, deaths every day. I saw 2 days ago, even including in my county, reports about deaths of infants, many of them in a day. And this is replicated the whole country over. You know, should the central debate about our health sector be on shillings and cents or on lives and livelihoods and tomorrow? You know, that's the question. And I see the look that you're giving me. You're wondering, you know, don't I think that I'm being insensitive to the fact that the discussion is should nurses be paid? and then one was paid.
Senator Matangi, don't interpret my look. You might get it wrong.
What I was just saying is simple. That should have been a discussion and debate that we dealt with a long time ago. Okay. You know, and now we are dealing with new things.
So, Senator Kajwang, what is the place of this statement by the president when he orders them to return to work and they're telling him that we are not your employees, we are employed by either the Public Service Commission or the counties?
The president based his order on a court order. Remember that the Council of Governors secured a court order that then allowed provided room for conciliation to take place, and conciliation was going to take about 60 days. And so I take it that the president was basing his argument that a court has ordered that you go back to work, so please go back to work as a conciliation process proceeds. Well, I just wish the president would have told his ministers to obey court orders in the Miguna matter, but that is now water under the bridge. The tone of the president is a little bit off.
Just hit you.
As Miguna sympathizer. I've tickled him. The tone of the president, I think, was a little bit too heavy, because such a matter of industrial dispute, a labor dispute, when you start saying, as a commander-in-chief of the defense forces, I hereby instruct. I mean, it didn't have to use such an intimidating tone. And really, if I was a leader within the nurses union, I would say that if the court has ordered that we go back to allow conciliation to take place, I would take that as you know, something that I would be compelled to follow. Let's not create another impression that the president now has got executive powers to solve industrial disputes. Labor disputes have to be solved through a certain process. And I don't even know why Governor Oparanya had to go to the president for the president to issue that statement, because we are now trying to create a picture of an imperial presidency, Baba na Mama, that will solve all problems. If it is a strike for nurses, if it's going to be a strike at the EPZ, maybe the president can go on TV and order the striking workers to go back to work. The basis of that order is the decision of the court, and not some new presidential powers that President Uhuru has just discovered. But more fundamentally, the president's legacy is extremely at risk. Extremely at risk. Because the big four, one is health, two is agriculture, manufacturing and housing. What is happening in agriculture and health? For us to achieve the lofty aspirations in the health pillar, you need facilities, you need equipment, you need personnel, and you need a population that knows how to take care of itself.
Okay.
In terms of facilities, we haven't done much. In terms of equipment, currently Parliament is investigating the managed equipment scheme. In terms of personnel, we don't have enough doctors. Boni Khalwale is a medical doctor, he'll tell us. And we don't have enough nurses. And even the few that we have, we cannot pay them well. When the president goes to DCI, he tells the relevant persons to give the CID officers a civilian clothing allowance. When we go to the police, we wake up and decide that we are going to change police uniform, notwithstanding the fact that we have a fairly good police uniform. When nurses are asking for uniform allowance because they feel that they need to be proper and prim, what is wrong with that? Then the other pillar on agriculture, you have had all the contradictions coming from the agriculture CS. So I think if we don't solve these matters in a proactive and proper manner, then the president's legacy would remain the handshake with Raila Odinga. Okay,
all right. Before I come to you, Senator Khalwale, I want us to cross over to, what is it?
What does
I want us to cross over to Alliance School, girls' school, where I understand that there is an annual event to celebrate Valentine's, and each daughter gets what? Gets a flower. Each class gets a cake. Do you have those pictures? Well, unfortunately, we don't have a proper signal from Alliance Girls. These parents celebrating the Valentine's Day with their daughters. Will be sure to cross over there once we have a clear signal. But Senator Khalwale, in closing on this topic, so where do we go from here? Because the Salaries and Remuneration Commission has advised the Council of Governors not to raise allowances for the nurses. The Council of Governors has advised counties do not pay any allowances. The President has said nurses go back to work or you'll be sacked tomorrow in the morning. And the nurses have said we're not going back to work.
When I saw that press statement by the President, surrounded by members of the Council of Governors, I couldn't help reflecting on it. The first question I asked myself, why are these people there? And to me, they were there for different reasons. The President was there not because he wants to get the nurses back to the hospitals, but because he's worried that one of his Agenda 4 items is affordable health. And obviously, if nurses are not going to be in the hospitals, that is a far cry from what would rather takes place. So the President was struggling yesterday to use that heavy language in the anger of the fact that this is a threat to one of his Agenda 4 items.
Right.
The governors were there not because of Agenda 4, but admitting that they are unable to manage a devolved function. The President and the national government.
Understandably so, because much of their resources, and I quote Machakos County, for instance, in 2017-18, about 14% is what was used on development. The rest, 86% went to recurrent expenditure, personnel, emoluments, as well as operations.
I'm going there. That's exactly where I was going.
Let's go there.
That governors have done very well when it comes to infrastructure development in our health facilities. Many of them have put up hospitals or improved on existing hospitals, put up dispensaries and other health centers. But when it comes to staffing of these facilities, when it comes to equipping them, when it comes to providing medicines and pharmaceuticals, governors have done very badly. Now let's look at the idea of the wage bill in county governments. It is actually avoidable. If you go to Homa Bay, for example, and Kakamega, there is a militia of youth who have been hired in the name of tax enforcement officers, when actually what these chaps do, they actually give the governor an opportunity to inspect a guard of honor, and they are the ones who give him that presidential sort of appearance. Instead of hiring those youth to make the governor look like a big man, they should have spent that money on hiring more nurses or paying the nurses better. In Kakamega, for example, we have over 2,500 such boys and girls who move around in green uniforms following the governor all over the place. You can imagine if the same number of people were either employed or the money you spend on this youth was used to pay our nurses. It makes me conclude the following, that maybe we should relook at the structure of devolution so that we say matters of employment of medical staff should be handled by the national government. County government should handle only infrastructure development, including staffing of, including purchase of drugs and pharmaceuticals for the hospitals, because that is really, that's where a governor wants to be there on the spot. But issues of employment to be handled by Nairobi the way teachers are handled through Teacher Service Commission.
Senator Matangi, do you agree? Is that the solution?
You know, let's
please respond specifically to what he just said.
Yes, but by putting some facts right, you know, on the table. One, let's remember that since the inception of devolution, after our first election in 2013, the first biggest debate, and I've been a member of the Public Accounts Committee in Parliament with Boni Halwale and now with Kajwang here for the last 7 years. The first item to hit the table of Parliament in Senate that time was the decision and challenge by the health community, that is nurses and doctors, as to whether they will agree to be part of the devolved system and whether they'll go to the counties. And they made that a big challenge. And since that time, the waters have never calmed down. It has always been that way. And so in the first place, we must agree, and I remember when there was the doctor's strike, then the nurses' strike again, all the discussions that were there, including the night vigils. And then I would want to remind my colleague Kajwang that actually at that time, remember, it took the intervention of the president that time to get things done. I rarely hold brief, or I don't hold brief for even the Council of Governors. But in our constitutional architecture, it is recognized that both levels of government do exist in consultation and cooperation on certain issues. And so, maybe, and I would assume that when the governors were there on this particular issue, because health is a major issue. You remember, I don't know whether all of us are clear about the incidents of the last time when there was the doctor's strike and nurses' strike. And remember the reported deaths that you people in the media reported all over the country in those hospitals. And right now, especially when we have made the milestones we've made, it would be tragic that would get back to reporting that kind of scenario. And so I don't want to laud governors, because I know they've committed a lot of sins against the people of Kenya, economic sins especially. and so I would be the last person to be saying anything so good to them. But I'll be saying that at least on this one, they might have been acting and sometimes maybe reacting quickly enough to avert a crisis. I believe that the way forward for us is to ensure that we have resolved this case. And I would not close this discussion without saying this, Sam. We have been challenging all governors when they appear in Parliament and in Senate, because no county in this country out of all the 47 has got a wage bill that is less than 70% of the amounts that they receive from national government. None. And so we have to admit that there is a major challenge, that when you tell a county that you're going to have now to spend so much more from your kitty to add to a wage bill that is already suffocating the counties, unless we take the approach, first, we have advised many counties, do a head count of your staff. Make sure that you remove ghost workers so that you can lower your wage bill. 2, rationalize. 3, introduce incentives whereby you could even give handshakes for people who are either obsolete or beyond their expiry date in their work, and so on. I mean, because you have county workers who've been in some counties that have already, that were employed by the earlier regimes who are no longer productive. That's what we're saying. Okay. So it's a big issue. It's a big debate.
Let me close on that.
Centralization of health. I am totally against it.
Right.
I'm totally against it. When in the last parliament, and Senator Kalwale was with us, we passed the health bill, which was assented to by the president. We created structures for intergovernmental consultation. Okay. We even created something we call Kenya Health Human Resources Advisory Forum or Council, because we were aware that counties must manage health, the facilities, the drugs, the equipment, and the personnel. There are counties where doctors would refuse to go to. Go and talk to, let me just finalize. Go and talk to the leaders who come from areas in Turkana or Mandera, or they would tell you that in the past when doctors would be posted from Nairobi, they would refuse to go to those areas. Or even if they accepted on paper, they would never be seen in those areas. And that is why there are some parts in this country that feel that they need to manage the health human resource. The failure of a few counties should not lead us to saying that health should go back to the center. Because there are certain counties where the nurses themselves are saying that we don't have issues with the governors. So I personally believe that we need to improve the provision and management of health services at county levels, and the failure of certain governors should not lead to re-centralization of this very vital sector.
Something is burning me. My brother Kajwang, I'm not in any way suggesting that we take back to the national government the health sector or function for that matter. What I'm saying is that medical personnel are so sophisticated, whether some people like it or not, that when you subject them to what they go through, and then they just switch off. Let me give you an example of a case whereby the governor wants to get quality doctors, either to be in charge of administration or to work in his county government. And they are subjected to vetting by MCS. I have a lot of respect for MCS. But some of those MCS, when they interview, when they vet some of those nurses, some of those doctors, you are demeaning these medical professionals. But that's the law. Yes. That in a case in Kisumu, there was a nurse I know who worked under me when I was in public service. Okay. She refused to be vetted by those MCS because they are way below her. They are not asking her anything to do with what she's supposed to cover.
But Senator Hamale, you can't validate that because honestly speaking, for example, like in Parliament, when people are elected, it doesn't matter whether you have got 5 doctorate degrees and then you're coming to be vetted, for example, to be an ambassador, to be a whatever. You have to subject yourself to the process of law of being vetted.
You're representing the will of the people.
We cannot encourage a scenario whereby doctors say they're too qualified to be vetted by anyone. I mean, they all in the medical personnel. I think they have to come and get vetted for public service. That's the idea. No.
I'm completely unable to put my point across.
But not it's not the medical test board.
Just hold on. Please make your point.
The point I'm making is that doctors are, not doctors, some of the medical personnel are so sophisticated that when you subject them, for example, to answer to the head of the department who might not necessarily be competent in their area, that interpersonal working relationship is completely gone. You see,
at the place of work, that is.
Get it from me. I want to tell you how it works. Why it was working very well with the national government, it is because doctors were not reporting to DOs and DCs and PCs. They were reporting to the PMO, the provincial medical officer of health.
Okay.
Yeah. It makes a huge difference that when a professional is reporting to somebody who is also professional and hopefully slightly more qualified than him.
Absolutely. On
On
professional matters, yes. But not on public service issues.
Unfortunately, for your information, 90% of the time of the working of doctors is not on anything else other than professional matters.
Okay.
Operating patients.
All right, Senator.
Could I make something useful?
Yes, your final word, because
Body has a good background. It's just that the way he puts his reasons,
help me.
The Cuban doctors that were imported into this country, in fact, we need an assessment of their effectiveness. You'll find one Cuban doctor servicing about 3 counties. We must build a system. Yes, because they are...
I thought you had 2 doctors every county.
No, it's different specializations. So they can move around. So like my county got a family health specialist, whatever that is. And then in the neighboring county got chiropractor or something like that. So they have to be shared. Doctors are so specialized and they are so few that we in Senate and the national and county governments must come up with a system through which you can share those rare expertise. And that was enshrined in the Health Act. A doctor, a specialist, a neurosurgeon, if Kakamega manages to have one, that neurosurgeon must be put in a situation where he can be shared by neighboring counties, not privately, but through an institutional
all
structure.
the more reason why it should be the national government employing.
All right, Senator.
You can do intergovernmental
we will
relations.
not resolve that in this forum, but I think it's a conversation that needs to be held and look at the best way forward. Pete from Nairobi is saying that Senator Matangi, government expenditure takes 70% of revenue, but just walk into any government office today, we have serious crisis of deficient human resource and acute succession management. Kindly explain huge salaries. I believe the recipients are elected officers, not government employees. I'll not give an opportunity to respond, but that's what Peter from Nairobi is saying. And of course, you can look at the dailies today. There are so many other stories that we may not manage to touch on, including on page 11 of the Standard that says that Uhuru's austerity measures stalled projects worth billions of shillings. Talking about how many projects affected. 545 major projects have been affected. The implementation of those projects have been affected by the austerity measures taken by the government. I wish you had more time to talk about that, but Senator Boni Halwale, former Senator of Kakamega, Senator of Homa Bay, Moses Kajwang, and Senator Kimano Matangi from Kiambu, thank you so much for making time for us on Daybreak. We hope to see you soon. Certainly for your views. Up next is the ICT Cabinet Secretary, Joe Musheru, will be coming to talk to us. You're shocked? To talk to us about leveraging ICT. Do stay tuned for that conversation. You can text us on 22422.
You might need to ask him about that article in the Standard also.
Sure. And you
Which one?
And you can tweet us at Citizen TV Kenya, at Samgitugu. Actually, it's from Buru, the hashtag to Daybreak. Asante ni sana.
Karibu.
You have brought him here.